Good evening, and welcome to our program this evening. This is your boy Rolando. You have joined us live here on XY Spark, and we are so excited this evening. We have a wonderful program lined up for you. We have a special guest that has decided to give back to XY Spark some of their time. Also want to say welcome to, I think he's one of our first time visitors, believe it or not, all the way from Australia, all the way from down under. So we want to welcome you. Thank you for joining us. We're glad that we have persons who are listening to us all the way, as what they would say, from down under. We have a special guest tonight that I want to introduce you to. And I know that she has a lot to offer, but just before I bring her into our conversation, just wanted to remind you that we have some wonderful things lined up for XY Spark. We hope that you're going to stay tuned. Believe it or not, we're almost at the end of our first season. And because of you, our faithful listeners, we have surpassed 7,000 downloads and counting. And we just are excited that you have decided to be a part of the XY Spark family. This evening, we have with us a very, very skilled person in what she does. We're talking about Dr. Unati. Dr. Unati, it's good to have you. Welcome to our program.
Hello, Rolando. Thank you so much for having me. Thank you. Thank you. I'm excited to be here.
We are excited to have you. Guys, I must tell you, Dr. Unati and I have been planning this for so long. And then I reached out to her, I think it was a couple of weeks ago, and said, Dr. Unati, when are you coming? And she
I
said,
know.
Rolando, tell me when you want me to come. And so she's here, and we're glad to have you, Dr. Unati. And so Dr. Unati, she's going to be telling us a little bit about herself. But just before she does that, just stay tuned with us as we do our short intro, and we'll be back with you real quickly.
Grief and loss, trauma, mental health, alcohol and drug use, gender roles, anger management, self-esteem, sexual abuse, domestic violence, and the pressures of societal norms are real-life issues that affect men. Join Rolando, psychotherapist, author, life coach, and motivational speaker that has dedicated his profession to working with men to find a healthier alternative to cope and handle these stressors. Rolando believes that men are lacking in social, psychological, emotional, and spiritual support that is necessary for a lifestyle that promotes healthy masculinity. We invite you to join us on XY Spark, where we discuss issues that men face. At XY Spark, we believe the key for happier families is restoring healthy masculinity.
Fantastic. We're going to get right into it. Dr. Unati, welcome once again. And can you tell us a little bit about yourself and what you do?
Hi, Rolando. Thank you so much. Yes, I am Dr. Unati Makiwane. I'm a family physician and a health coach. I focus on men and boy children. People always ask me, why do I do that? And I tell them all the time, I'm a mom to a boy child. Of course, I have a little girl too. But I felt there was a big gap just in the world, looking at the stats, by World Health Organization, United States, United Nations. They always give us the stats about, men committing suicide, men involved in gender-based violence. We look at who is mostly incarcerated. It's mostly men. Mostly men comprise the high percentage of homelessness. So I felt even in my practice, when I look at men, they usually come late. You'll probably agree with me. They come for help. So I wanted to be out in the community and do more and more community-based work to connect with men.
Yes, yes. Dr. Nati, you are the second female that we have are hearing that you see that there's a gap. And when I say that, this is not in any way disregarding all my other female guests that have been on the program, but I'm talking about a female guest that specifically is concentrating on empowering men. So tell me a little bit about the work that you do and what have you seen, and how have you been working in that area? Because we want to talk about men's mental health tonight from a physician's perspective. So tell us a little bit more about your work, Doc.
Thank you so much. Yeah, like I said, I deal with men in my own private practice, and also I have a show outside my practice where I connect with a global community of men. We meet once a week on
Mm-hmm.
Sundays for an hour or so. So basically, like I said in the beginning, men are wonderful, and the sad part is a lot of times people don't realize that men have the same emotions, they feel the same way as women. So when I see them coming to me, to my practice, really beat down by life, and seeing that they only come probably even after a year or years of suffering, Rolando. So listening to their sad stories and them breaking down in front of me, it just tells me that truly, as a woman and also as a mother, with my maternal energy, indeed, men need spaces, safe spaces. That's basically what really pushed me to do this work. And honestly, to be honest, I've been thinking about it over the years. Last day, that was actually the it that made me do it, because there was so much need. A lot of my male patients were calling in. They were abusing more drugs. People were drinking a lot more because people are locked down. It's COVID-19, the pandemic. So there's so much of stress. People lost jobs, and a lot of depression, family breakdowns, divorces. Here in Canada, we had that there's like increased rate of divorces, right? So I just wanted to be that safe space to hear and see what is it exactly that men are struggling with. And now there's a lot of stuff that is coming up even from childhood stories.
Oh wow, wow! Doctor Unati, I had on my program Doctor Kelly Palfy. I need to reach back out to her, but she wrote a book entitled "Men Too," and one of the things that she spoke about is the huge amount of sexual abuse and trauma that not just affect men but a lot of our younger boys as well. And Dr. Kelly Palfy, she really emphasized a lot of that stuff, and she works with men in that area. Tell us a little bit about what area of mental health do you find men are struggling with now more than ever? I mean, we've been in a pandemic now over a year. You talk about the high rate of divorce. What have you seen more prevalent in this over the past year than what you're normally seeing in your practice?
Yes. You know what? Increasing anxiety. There's
Mm,
there's grief and of course depression, as we both know, they overlap, right? There's a lot of anxiety, Rolando. There's a lot of depression, alcohol abuse, and other drugs, and of course PTSD. People are triggered right now, right? Recently, I had a client who shared his childhood story. With all this loneliness, people have time now to be with themselves, right? So there's a lot of grieving, a lot of people, they are losing their families, and some people, they can't even travel. Last year, even here in Canada, we couldn't travel to Maritimes, right? I had few people that couldn't go bury even their families. The time was too short. So there's a lot of guilt, there's a lot of pain, and also there's a lot of the depression that comes with the sense of loss. People lost their jobs, they don't feel men enough, you know, and that drives, the anger. And of course, we we know that men in depression with depression tend to show or present a slightly different compared to the women. There's a lot of anger, irritability, and when you dig, you find that these people are depressed. So there's that lot of basically alcohol abuse, anxiety, the uncertainty of what's going to happen. People lost jobs, and there's just so much pain. I'm saying.
mm-hmm, mm-hmm, mm-hmm. Doc, as I'm listening to you, one of the things that I'm doing right now is I'm just in the process of seeking to create, as you say, that safe space for men, and that's our passion here on XY Spark. Dr.
Yeah.
Unati. We want to provide that safe space where men can know that here's a place that we can reach out to. Here's someone that we can talk to. Here's someone who understands. Because in my own life experience, Dr. Unati, I've had my experience with drugs and alcohol. You
Right.
know, and so I'm not a guy who is here seeking to provide support for men who doesn't understand. I understand it.
You
I've been
get
there.
it. You get it.
I get it, and I want guys to know that I get it about being divorced because I've been there too.
Mm. Mm.
Okay, so I want the men who are listening
That,
to
right? There's a
to
lot of
roll.
that.
Yeah,
A lot of that.
yeah,
People, they feel they failed in life. We tend to have this mentality that by the age of 35 I'll be all set, my career, you'll have your family. But boom, even way back, like, I mean, before even COVID-19 hit, people had lost jobs in Alberta alone. Because of oil, people had lost jobs. So there's a lot of shame, there's a lot of guilt that they are not men enough. There's this, unfortunately, it's across board, across cultures. Men have been given this leadership role. So people, when they lost jobs, they felt they were disarmed, right? I think you are seeing that in your practice too. There's a lot of pain. There's a lot of pain. I think I'm so happy there's more men like yourself doing these programs for men.
yes. And Dr. Nati, my passion is to take this to the world. We have one of our listeners out there, and he's saying 35 to 40 is tough as a male as is 27.
Yeah.
And thank you for sharing that. But he's saying that 35 to 40 is tough as a male
Yeah.
as is 27. So he's saying there's no difference. It's tough right across the board.
Yeah.
Okay.
Yeah.
And you know how do we help these men? You talk about all the different mental health, because Doc, I'm telling you, in my role at XY Spark, sometimes I wish I could clone myself
I
when
know.
I hear the stories from a lot of, and I hope it's okay for me to say this, but when I hear the stories from a lot of my brothers who call in, who connect with me,
Right.
okay, and I use the brother as a term that's generic right now,
Right, bro.
okay,
Yeah.
when they reach out and I hear the stories, there are guys who, they're struggling because all of a sudden, here's what one of my guests said. I'm Dr. Unad. One of my guests said, Rolando, one of the things that I struggled with in my own relationship is that if I express emotions to
Yes.
my partner thinks I'm weak, or
Oh,
my partner thinks I'm not man enough. So he's saying if I express that emotion to my partner, to my wife, she's going to wonder if I've lost my manliness.
you
And
know what,
that
Orlando? It's funny you are mentioning that. And I love Brene Brown's work. She talks about vulnerability. Vulnerability is strength, guys, right? And I think actually the reason why I also do what I do is to also empower women and to also bring them to that awakening and consciousness that men are not weak when they express their emotions. And it starts with how we raise our boy children. It starts with mothers. What do you tell your boy child when he's hurting? What do you tell him when he's crying? Even fathers, what do we tell our boy children? Because that's when men close up. It's what you told them when they were kids. So I think we need to rewrite the stories right now. I think COVID-19 has showed us that all of us feel, right? We all feel. And like I said, initially when COVID-19 hit, I saw a pattern. Even my assistant at work said, have you noticed that we are getting more calls from men? I was like, yes, I've noticed that. So kudos to men who are willing to share their vulnerability and seek the help they need. So honestly, to our listeners here, if you're a woman here, create that space for your man. Create that space, because that's how you're gonna connect to him, even at a higher level, deeper level. Can
Yeah.
I tell you something, Rolando? Since I started doing my work, I've been with my spouse for 13 years. He's sharing stuff, not necessarily anything gross, but I'm like, wow, I guess I have changed even myself for him to share himself so vulnerably like that. So even myself, I have changed. I guess I am changing to be more sensitive, to be more compassionate and more loving and accepting. So honestly, it's so beautiful. And listening to other men outside my home sharing their stories, you see that people have the same problems. They have the same experiences. How many men we know of were molested in childhood? People don't talk about those stories. They've never
That's
shared with their, like, that's what I'm getting lately. That's what I've been getting in my practice. Men are sharing their stories of pain. They were molested when they were young.
mm, mm,
So there's so much right now. People are with themselves. When we work, we are on traffic. We are on this noise. But now, COVID-19 happened. We are silent. We are listening to our
mm-hmm,
souls. People are connecting now with themselves. Those stories are creeping up. Pain, and that's when people start numbing themselves with alcohol, with drugs. Right?
mm-hmm,
Yeah,
mm-hmm.
there's so much happening.
Wow, it's true, but I want to piggyback on something that you said, Dr. Unati, which is so true because I find that more men are actually starting to come out of the woodwork,
Yeah,
and that's so wonderful
it
to
is.
know, because that makes me excited, because our motto here at XY Spark is we believe that the key to happier families is restoring healthy masculinity.
Of course.
Okay, so as you say that, tell us now, um, how do you what approach do you take when you meet these men? How do you help to reignite that flame? Because
Yeah.
mental health, because of the stigma that goes with it, and
Yeah.
one of our guests here, he mentioned that earlier before we started. He said that there's a lot of men who see the idea of having mental health as a weakness,
Yes, yes,
and I really want to say thank you to my guest for saying that they see mental health as a weakness. And our guest says, hey, guess what, I struggle with mental health
right.
post incidents, but that can be, he says, cumulative with other things like family life, etc. He says when mental health is career related, it can feel extra lonely. Do you want to speak to that, Dr. Unati?
I do. I think the key thing, my approach in general, in my practice, I preach preventive medicine. And when we embrace our mental health, we are well physically, right? And vice versa. When I'm not feeling well physically, things start getting me worried, right? I get anxious. And then, of course, it's a roller coaster, right? And then it snowballs. So the approach I have as a person, I'm approachable. I create that. So I think the key thing is actually recently I've been getting a lot of male patients and they're like, I just felt safe with you. Immediately I entered this room. So the aura I get into that space, into that room when I come in, you the way I am approachable, it opens them up. So I think the key thing is we need to, I always tell people, connect with your therapist, connect with your doctor. Don't be scared to fire him or her if you are not connected because you want to be yourself, right? Because you are
Mm,
bringing your vulnerable self here. You are bringing yourself to a stranger, something that you've kept in your heart for so long. Recently I had a man who told me that I never told my mom what happened to me, my dad. And actually, my mom didn't believe my brother's story. So I kept quiet. I only shared it in my 40s. Imagine that pain and what he knew
mm-hmm,
all along. I congratulated him for staying the course and stayed till this far, even if it made him suffer that long, but he managed to be here because a lot of people have committed suicide, Rolando. We've heard stories like that. People could not bear the pain. So, approachability, you need to have that connection with your clients. You need to have that openness and that compassion with your body language too. And of course, you preach. For me, I create stories like even sexual health. Married male patients sometimes they're scared to talk about erectile dysfunction, and the issue is erectile dysfunction is not only affecting older men. Like I said, it's stressful right now. Stress would cause low libido and would cause erectile dysfunction at some point. So we do see it even in the early 30s. So I create these conversations. I make it easy for my patients. I start such a conversation and people start talking up. So I believe when we start these conversations and normalizing them, and spaces like XY Spark and what I do will create and normalize conversations like this. And to be honest, I don't know if you know about this app, the Clubhouse. It's a beautiful space where I've seen men showing up in a manner I've never seen. If you're not, please get on that space. Men are sharing their stories. And I think it's because it's audio. People are feeling free to talk and they are seeing that, oh, wow, I'm not alone. Other people
Mm-hmm.
their stories. So it's another beautiful community I've seen men progressing in terms of sharing their stories. So I think that's basically the way to go. Connect with your therapist, connect with your doctor. Are you really connected? If you feel you're not yourself, drop him or her. I always tell my patients, fire me if I'm not listening to your story.
Wow, wow, Doc, it sounds like you're going in a place there where you're getting other professionals upset, you
Yeah,
know. But Doc,
yes,
here's a question that I wanted to ask you because uh, is there a cultural piece around this? I mean, is this mental health thing, do you find that different cultures approach it differently? Do you find that it's easier for some culture than others? What have you seen in your practice?
yes, you're right. You know what though? There is a piece of that, and also there's also a general piece. I'll say a little bit more on that. First of all, I'm African. I'm from South Africa. In South Africa, I don't remember. I practiced there actually 5 years and here 10 years in Canada. But in my 5 years in Canada, I don't remember prescribing an antidepressant or talking to a man who was depressed. Well, probably, when I was still in, residence, when we were finishing, we'd seen people with bipolar, in their depressive mode. But usually when people coming in to consult, never. I've never seen a man, black man, coming to me. But when I did locums in white practices, I would see white men coming in and asking for their prescriptions for their antidepressants and anti-anxiety pills. So there's
Mm-hmm.
that. I think us in the black community, even the words we use. Recently, actually, in one of my shows, I was actually debunking those terminologies, the crazy words we like using as Africans. People, they believe that if you have mental health struggles, oh, he's crazy, or she's crazy. Do you know that in Nigeria is our highly populated country in Africa, but in Nigeria, few years back, I was looking at their research and also the psychiatrists to the population, to the general population, very few psychiatrists. There's stigma, even for doctors not wanting to get to that field. Can you imagine? So
Mm.
there's so much work we need to do in our community. So there's that. And I mean, also, I see also in the Arabic community, the Muslim people, I don't see it as something they talk about. It's a non-spoken issue. Like people don't talk about it, and sadly, we've seen. You and I, we know about the big community of Syrians that moved into Canada. They came from war zone. They
Mm-hmm.
definitely have some PTSD they are dealing with. Post-traumatic stress disorder is a reality in kids and adults. But you know what? We need to get to their communities. And I think the other thing is language barrier. So people tend to contain these emotions. And of course, if they never grew up talking about emotions like that, it's an issue. But I find Caucasian community is more ahead. They talk about their emotions. And I think it's just their culture. They are more open. But like I said, COVID-19 has opened a lot of people, cultures. People are talking about these things. There's more awareness.
Wow, I mean, as I'm listening to you, in my own practice, I can probably count easily
Yeah.
on my two hands the amount of Afro American men that I've seen walked into my office and say, Rolando, I need help.
Yes.
And it's one of those things that I worry about too. but I'm also seeing that a lot more. I'm seeing a lot more variety of other men coming out from the woodwork,
Yeah. Yeah.
and accessing it, because we want men to understand that, guess what, it is better and it's sweeter if you reach out for help sooner rather than later.
Yes.
And what we're saying here is, if you recognize that you can't do it on your own, there's no shame in reaching out for someone who can offer you that help. That is, believe it or not, guys, that is what a real man does. A real man doesn't hide.
Please, Roland, when they hide, what do? There's more drinking. There's more violence, right? Because they are angry with themselves, right? There's more drinking. There's more exploration with other drugs. There's more breakdown of relationships. There's gender based violence. So that is coming from pain. And unfortunately, there's sometimes suicide. So that suffering alone and not speaking, I think we need to have more role models, more icons. I always say we have all these icons, Oprah's, the Michelle Obamas, they speaking beautifully and advocating for girls. Where are men? Where are men, Rolando, speaking in those platforms? Because those people have a voice. But I always say we're gonna create these spaces here, and maybe we're gonna shift. And hence, I'm saying, as a woman, as a mother, and as a physician, I'm coming to such spaces. Right, I'm actually excited. I don't know if you know. I'll be one of the speakers on one of the biggest conferences. There's a World Diversity Conference that's coming up actually to Edmonton. I'd love to see you there in July, and I'll be speaking on this topic of men's
Mm.
workplace. So I think it's gonna be fun to be in such a big space. Apparently, they're expecting 5,000 registrants. So we need to be speaking in these platforms. And like I said, it's not only for men. Men, I think, will come out when we women are creating these spaces for them.
We have a question here, Dr. Unati.
Sure.
One of our listeners is asking, why do you say alcohol and drugs is used to escape from pain?
Right, good question. Like I
Is it a known thing or an observation?
It's a known thing, an observation. It's on the studies. Man, like I said, it goes back to how they feel. When we are raising boy children, you remember you are told men don't cry, boys don't cry. So how do you feel? All along, you grow up with that pain. Men have been taught or have been groomed to repress. Understand? Look at mostly who goes to the wars mostly. Men are out there, right? Yes, we have females today, they go and be soldiers, but men have learned to internalize pain. And how do you do that? Because we are humans. Like I said, we all have our pain centers. We all have emotional centers. So we all feel emotions. But how do men express? How do men release? Men, unfortunately, because they feel that pain. Women, us, it's easy to talk to that girlfriend. You have your friend, you can share your pain. Men, they would rather talk about cars, about their careers, and all that stuff with other boys, right? But instead of speaking up and sharing what they are struggling with, what happens? They escape by doing drugs because they're thinking, okay, it's going to calm me down. Because, like I said, the stress, the chronic stress, the pain could lead to depression and anxiety. Recently, actually, one of my patients was telling me that, you know what, I've dealt with my anxiety by smoking. Nicotine calms me down, right?
Mm-hmm.
And
Mm-hmm.
also drinking calms me down. When I can't sleep at night, when I'm struggling with my thoughts, I drink to sleep. So that's
Mm-hmm.
basically the link there. And then
Mm-hmm.
that's when addiction kicks in because, again, you cannot use the wrong to correct the wrong,
Mm-hmm. Mm-hmm.
right?
Mm-hmm.
So I
Mm-hmm.
think that's basically what happened there. The connection is men have, or boys have never been given spaces to be and be vulnerable and show how they feel.
Mm-hmm. And Dr. Unati, as you talk about your program coming up in July,
Yes,
here at XY Spark, we're planning to have a men's march, mental health awareness march. We're hoping that this pandemic will go away, but we want to do it on Father's Day, June 20th.
I love it.
And that march, believe it or not, we have some wonderful people who are a part of promoting this. We have Men 360 out of Ontario.
Right.
We have McMahon. We have Dookie Psychological Services.
Yeah.
We have therapeutic intervention services. We have four men, that's a group out of Rocky Mountain House. We have a Sikowin Friendship Center
I
out of
love
Rocky
it.
Mountain House. And so we're planning all of this. Even so we have that program planned, and we want to take it Canada wide. We should be having it in Nova Scotia, or should be having it in Edmonton, we should be having it in Rocky Mountain House. We want to have
Really,
it
I
here
would
in Northern
love,
Alberta.
yes, involve women.
So
We involve
absolutely.
women, Rolando, because if you do it alone, these men will go back to the same women. Because also women, we can be very hurtful. You know what I mean? So
Yeah.
women sometimes, because again, that's how they were also raised. So that's why they're not creating such spaces for their men. So I think it's about time we also educate women, right?
And
So we
yeah.
need to empower women and open their eyes and see how much their men are suffering.
And I agree with you. And so even now we have been talking to um, the Canadian Mental Health Association here in the Wood Buffalo region where we're located, and they're looking at how they can, and the goal behind this program that we're planning, Dr. Unati, is we want to donate 75% of the profits to provide a fund where men can come and just access mental health support. So if
I
they, 'cause we
love
know
it.
the struggle is real now, so I'll be sending you the poster and stuff, and you can,
Wonderful.
'cause we wouldn't mind having that down where you're located too at the same time,
I would love to be part of that. Guess what? It's interesting. One time I was driving our son to school, and I listened to. Sometimes we just tune into these Christian radio stations, and then they were talking about this women's shelter, right? And then I remembered I had promised to go and speak for them one time to encourage their women. I think maybe 3 years ago, and my son knows about my work, and then he said, why would you not, in the work you want to do, mom, why don't you create a men's shelter? I didn't
Hmm.
hear about men's. I was like, wow. I actually talked to to his dad about it. I said, you know what, this boy came up with something amazing. And indeed, with the space, it's small what I do in my men's talk. I would love to create a really nice, even if it's like a virtual studio for men to connect.
Absolutely,
You know what
and
I
that's,
mean?
oh yeah, oh
Yeah.
yeah,
So I took that as a challenge that really we need such spaces. We need to create these spaces for men.
yeah. And so
Congratulations. I really love what you're gonna do. I look forward to be part of that.
I will be sharing that with you. So
So
what you're saying, Dr. Unati, is in order for us to have healthier men in the community and stuff, or men need to just start talking more about those emotions.
of course. Of
They
course.
have nothing to be shamed about, or no reason to be hiding it or anything.
Of course, men feel the same way. We have the same emotions, and I know it's been lies for decades. I mean, we both know that sometimes it could be biochemical imbalance, it could be physical issue like thyroid, right? Because some people, when they have low functioning thyroid, they could have depression from it, or if it's an overactive thyroid, they could have anxiety. So these things, we need to deal with them. So I encourage men all the time, go for your physical examination, because sometimes it could be a medical issue and then it gets ruled out. Medication is not something we always jump into. Sometimes a lot of these things are dealt at a level of psychotherapy, right? You go see Rolando, or Rolando, if he sees that, I think you need to be on medication, because you basically look at, is it severe, is it mild, or is it
Mm-hmm.
moderate, right?
Mm-hmm.
So there's a place for everything, right? So sometimes people do well with psychotherapy once they start sharing those stories. So I encourage men to always go see that. Don't wait for too long. And sometimes, like things like stroke, man, there's a sense of loss there. There's grief. Suddenly you're in a wheelchair, right? Some people, they feel depressed for not being anything now in the society. That's how they view the way now they would live their lives. So things like that, or maybe a new diagnosis like you fearful. You are diagnosed with diabetes. You are worried. You know that you've had that diabetes could lead to erectile dysfunction, and that could lead to your manhood being challenged there. So there's a lot of other things that I feel, man, if we could start seeing them more to our clinics, things are preventable. There are medications for erectile dysfunction. You know what I mean? So I think that's the key thing. That's why I do what I do. I encourage men to come to see us, right? Because these things could be solved, really. And if there's a place for medication, yes, absolutely. If you need to be seen at a rehab center to be helped, yes, of course, you have to go. I mean, there's an element of family history too. What if there's family history of alcoholism in your family? So there's a lot of things that need to be unpacked.
Hmm. So my last question, Doc, because I need to, I know it's getting late and I don't want to wear you out.
I'm enjoying this. Fun.
But here's a question that I wanted to put in there because, you know, there are a lot of men who the mental health has pushed them to a place where they have become totally dependent. Cocaine, alcohol, all that piece. Now, the two, if someone is struggling with a substance use, does it exacerbate the mental health to another level? Do you recommend that they address that piece in order for the mental health piece to get what thoughts can you put in that there? Because there are some men who believe, hey, I have to stay with my drink, man.
I know.
I have to. So
It goes back to the unpacking that story, because like I said, I've had few men telling me that, my anxiety is helped by my drinking, right? And actually, you know what, recently I also had a patient who had ADHD, and there is an anxiety, the anxious type of ADHD. And now, when we addressed his ADHD, put him on medication, said, "Wow, doc, I feel different. I'm not as anxious. I'm sleeping better." So again, it goes back to your history. We need to take proper history, right? So again, find that connection with your doctor, find that connection with your therapist, find that, because I've had so many referrals from therapists feeling that, you know what, I think it's time for you to be on medication. So I find usually it's usually people go to the community first, they find that therapist they connected with, and then they come back to us and say, you know what, my therapist, I've been seeing him or her for some time now, he or she thinks that I need to be on medication. So that usually I always encourage people, find that trusted person, trust that person you can share your story with, and then unpack that story, because usually they overlap. Sometimes, like I said, usually the other one comes first, right?
fantastic. Yes.
So that's what happens. But usually that pain, that emotional pain, is the one that pushes people to go to those drugs, because it's an
Mm.
unaddressed pain, right?
Yes. Doc, you know what? Thank you so much for being here with us tonight. We are so glad you decided to come. And for me, Dr. Unati, we just wanted to hand to you the official flag, the official hand of welcome to the XY Spark family. And if ever you need to connect, to reach out to us, to come and be, a part of our conversation, please know that you're more than welcome. Guys, we are here every Wednesday evening at 9 p.m. Mountain Standard Time. I'm not sure what time it is for my guests down in Australia or wherever else you are, but we come here every Wednesday evening at 9 p.m. Mountain Standard Time. We're here on Saturday evenings at 8 p.m. Mountain Standard Time, and we are on some Sundays as well, depending on our guest availability. But we thank you. Right now, it is two. I think it's two p.m. In Australia right now. Wow. So it's
Wow.
2 p.m. in the afternoon right
Wow,
now in
it's an
Australia.
interesting
Or
space,
yeah,
right?
yeah. Our guest just sent that in here. Thank you for that. And so wherever you are around the world, just put in your calendar and know that XY Spark is here for you. Or guess he has a sense of humor. Now. He says he's from the future.
Wow, I can
I
feel
like his
that.
sense of humor. Yeah.
Yes.
I agree with you. I agree with you, my brother. You are from the future. But guys, we just want you to know that we appreciate you. and we love that you have decided to make it XY Spark. And the one thing I wanted to close off with is, guys, remember, outside of everything else, before you're a husband, before you're a father, before you're an employee, before you're a man, you are first a human, and you can't forget that. You be human, and then everything else will come easier. But if you forget that you're a human and try to be everything else, it's going to be much harder. Guys, we thank you so much. Dr. Unati, any closing words before you go?
Thank you so much, Rolanda. I really enjoyed this. I just want to have a voice or a word from my brothers out there that we love you and celebrate you. And just know that you are human and feel those emotions. Open up. Find that person you trust. Find that person that you can open up and connect with your therapist or your doctor so that you can share your story, because healing is possible. Thank you so much.
Thank you so much. And as usual, guys, this is your boy Rolanda here on XY Spark. Thank you so much for being with us. And we will see you again real soon. Have a good night. You keep safe. And remember, June 20th, big day, put it on your calendar. XY Spark is going out there to promote men's mental health. Look out for it. If you want to become a sponsor, you can email us at Hyman, Hyman, at xyspark.info. You can check us out on our website, contactxyspark.com. And Dr. Unati, how do you do anything virtual? How do they find you? Because I didn't even get you to put that in there. So as one of our listeners want to connect with you in the virtual world, how do they find you?
Thank you so much. I actually have a show weekly. It's
Mm.
Dr. M Health Corner. You know what? Maybe people could email me too. I'm just texting it for you there.
Mm-hmm.
People can just look at my work here.
Okay, yeah, I
I
see it.
have,
Yeah, I see it. Yeah.
yeah, I just have this.
Okay.
I think it's gonna be easy for people to just connect, and my
Mm-hmm.
email address is gonna be there.
Mm-hmm. Mm-hmm. Fantastic.
I
Okay,
got it
great.
right all there. Yeah.
Great. Okay, guys,
Yeah,
that's how you can
Dr.
find
M
Dr.
Health Corner. I mean,
Unati.
the space of Dr. M Health Corner. I also give every Friday. I do a show. I have two shows. I have a Friday one, which is general. I bring specialists from. I need to bring you actually along. You need to come to my show. Uh, yes, I need to bring you on. I bring people on Fridays and also the other one on Sunday. That one specifically is for men. And I've seen men actually bringing in their spouses. So it's been wonderful to have them.
Great. Fantastic. Okay, guys, in the meantime, we just continue to say you take care and tune in XY Spark. We're just building momentum. We're almost at the end of our first season of XY Spark. Season 2 promises to be greater and have more compact presentations. Thank you again, Dr. Onadi. Thank you to all my listeners. You guys have a good night, and we'll talk to you again real soon.
Thank you so much, Rolanda.
Please join Rolando next time on XY Spark as he engages us in practical discussions that promotes healthy masculinity and challenge men to live extraordinary lives. At XY Spark, we believe the key for happier families is restoring healthy masculinity.